Okay, so this is Lonnie Johnson, and I'm going to be doing my abdominal, GI, and renal assessment. So come into the room. Hi, my name is Lonnie. I'm going to be your nurse today. I'm going to perform hand hygiene and make sure that we have privacy for the patient. Closing the door, whatever. I do have a sheet provided. The patient has asked that I do not expose them here, so I will be remaining the sheet. I'll do a majority of the assessment over, and then I will report my findings when I need to look under. So today we're going to be doing an assessment on your abdomen here, so I just have a few questions if you don't mind. So first of all, can you tell me what a regular diet is like for you?
Try to eat 3 times a day. Try to incorporate a couple of fruits and vegetables here and there, but just normal. I don't eat much fast food.
Okay, sounds good. And then what about like fluid intake? You drink a lot of water?
Yeah, I'd say probably on average like 4 bottles of water a day.
4 bottles of water, okay. Any caffeine or alcohol intake?
No.
So you don't drink caffeine at all?
I don't. Well, I drink coffee in the morning, I guess.
Okay.
Yeah.
Like a cup, 2 cups?
1 cup.
1 cup, okay. And then any alcohol?
Maybe on the weekends.
Okay. About how many drinks? Like 2 to 3, 4 to 5?
Probably 2 on Saturday and 2 on Sunday.
Okay, so like four
Yeah.
drinks. Okay, is it alcohol or beer?
Beer.
Beer. So about 4 beers a week?
Yeah.
On average? Okay. All right. And then do you have any history of like abdominal surgery? Have you had like your appendix removed, your gallbladder removed?
No, nothing like that.
Okay. Do you have any pain in your abdomen?
No.
No. Okay. Any family history of any like maybe cancer, like colon cancer, stomach cancer, anything like that?
No.
No. Okay. And no appendicitis, like no, you still have your appendix, right? You
Yep.
said that? Okay. When was the last time that you urinated?
A little while ago.
Okay.
Hour.
And then hour or so, okay. Was it yellow? Was it dark yellow? Was it
Yellowish, lightish yellow.
Okay. Any sediment or anything? Like did it look like there was anything floating in there, or was just
No.
no? Okay. And no pain when you were urinating?
No.
Okay. Perfect. And then your last bowel movement was when?
At lunch.
At lunch. Okay. So do you have a bowel movement at least once a day?
Yes.
Okay. And then what was the consistency? Like was it soft? Was it hard? Did you have to strain? Was
It's
it
solid, no straining.
okay? So formed, was it with no straining? Okay, and it was just brown, no like black tar or anything like that.
Correct.
Noted, no blood or anything, and no pain when you were?
None at all.
Not at all. Okay, perfect. Okay, so at this moment, I'm going to be doing the actual physical part of the assessment. So I would be putting on gloves, and then the first thing I'm going to do is I'm going to go ahead and examine the abdomen. So I will just pull the sheet back to remain. Okay. So the stomach is a little bit rounded. First, the patient is laying down. So the stomach is rounded, and I don't see any like scars. There's no like noticeable veins or anything. There's a little bit of striatum here on the bottom. And then I just have to ask you, sir, do you feel like this is a normal shape for your stomach? You don't feel distended or like your stomach is being pushed out or anything like
It's
that?
normal.
Right? Normal. Okay, perfect. And then you said no pain already. So I'm going to go ahead and just listen to your stomach and see what we can see. Listen. Okay, so I'm going to start here in your right lower quadrant, and I'm just going to listen to see if I can hear. Okay, so you've got active bowel cells. How long ago did you eat, sir?
About an hour ago.
An hour ago? Okay. So I would say the bowel sounds are regular, they're present and normal in all quadrants. Up here you can hear it's a little bit more active, but I wouldn't say it was hyperactive. And then I'm going to do some palpation. So I didn't note any thrill or anything on his stomach yet, but I will make sure to check for that when we are palpating. So first, sir, I'm going to do a light palpation where I'm just going to touch across the quadrants here of your stomach. And then I'm gonna have to do it a little bit deeper, okay? So the first one, we're just gonna kind of, and just tell me if you have any pain at all while we're doing this, okay? Are you feeling any pain?
No.
Okay. Have you noticed any lumps or masses or anything like that in your stomach?
No.
No, okay. Okay, so that's pretty good. I don't feel any lumps or masses, and he's not expressing any pain. So now I'm gonna do a little bit deeper, okay? So just kind of, sorry if it hurts. I know it's gonna be a little bit uncomfortable, and I'm just gonna try to push all the way around so I can make sure there's nothing. You okay? Don't hold your breath. Just try to keep breathing. I know a little bit painful. Okay, so I don't feel any masses, like I said, again, no thrills were noted upon the palpation. So I will be doing 2 other things. So we are going to find, let me see, I just need to find your hip. Can you do me a favor and kind of flex your leg, your thigh, flex your leg up, like bend your knee real quick for me? So I can kind of find, there we go. Okay, perfect, put your leg down. So we'll go there to belly button and about the halfway point here. And we're just gonna push down. Any pain there?
No.
No, okay, so negative for McBurney's. Now I'm gonna pull my hand away, you tell me if there's any pain when I release.
No.
No, okay, perfect. So negative for no rebound tenderness, okay? And then the last thing that we're gonna do is I'm just gonna palpate right down here. This is gonna be your bladder. So I'm gonna push in and try to see if I can fill your bladder. Now you said you urinated about an hour ago, correct?
Mm-hmm.
Okay, so I don't know if I'll be able to fill this, but I'm going to try to fill your bladder, and then you should have the urgency to pee. So just let me know. Does that kind of give you? Okay,
Yeah.
and I can fill the bladder just a little bit. Doesn't feel like super distended or anything like that, but it is there. Okay, perfect. So, no tenderness noted in all 4 quadrants. Upon light and deep palpation, no thrills noted. No scarring from abdominal surgery. I didn't see any other abnormal markings except for the striae that was located on the right and left lower quadrants. Negative for the McBurney sign, and then no rebound tenderness, and the bowel sounds were active in all 4 quadrants. Not necessarily hyperactive, but more active in the top 2. But the patient did say that he had eaten. So he has no pain, no history of abdominal issues, and no family history of abdominal issues. Urinating normally, without pain, having bowel movements regularly, daily, also with no pain or straining, a formed stool, no abnormalities noted in the stool such as tarriness, blood, anything like that. And beyond that, I would say that the assessment would be completed and the patient would be free to go. Thank you.